Hi, I'm Dr. Lisa Reinecker, registered counsellor specializing in trauma.
Hi, I'm Nadia De Castro. I'm also a registered counsellor with a special interest in trauma. I think we can start by discussing what trauma is.
So, trauma is any event where you feel out of control, and it is something that happens to you, not because of you. It can be anything from a hijacking to a car accident to family abuse when you were little. Yeah, it leaves a psychological wound on you, and it impacts your well-being and your daily functioning.
So what's interesting about trauma is sometimes it's not always the situation, but how we perceive the situation. And that's also important to explore. And that's where trauma debriefing comes in, where we normalize symptoms, work through healthy ways of coping and managing what we've just experienced as well.
Yes, in trauma counselling, then we take it a step further and we look at how it impacts your daily functioning.
I think what's also important is to realize that trauma debriefing and trauma counseling can't happen within a specific time frame, because once these situations happen, because of their occurrence being so spontaneous, once these situations happen, we need to allow the adrenaline to settle in the body and then work through healthy ways in which we can navigate our thoughts, our feelings, and our actions.
Yes, it's especially important because trauma can lead to other problems. For example, depression, anxiety disorder, addiction, and we need to address it so that you can function. At Evexia, we find lots of our patients come in with especially childhood trauma.
And I think
which is chronic and complex. So that is why we offer trauma counselling in an empathetic environment, so our patients can navigate through the effects of the trauma.
I think what's also so important to realize is that Evexia operates from a multi-disciplinary team that attends to the different aspects of life. And during attending to the different aspects of life, a lot of trauma comes, and there needs to be something to maintain and facilitate the trauma, and that's also our role in the practice. Thank you, guys.
Thank you.